Hi guys, my name is Dr. Joe Brown. I want to talk to you today about what vegetables I want you consuming that helps prevent breast cancer. If you guys know anything about my practice and what I've done for almost the last 20 years, you guys know that I'm a naturopathic doctor that specializes in preferably and especially cancer care and cancer help when patients are going through chemotherapy, radiation, and surgery. So what I want to do today is I want to give you a list of certain foods that I want you not only eating but juicing. So if you want to get out a pen and paper, I want you to write some of this stuff down. Okay, let's get started. Number one, garlic. Okay, so what I've done is I've just put a few of these things here on the cutting board just to kind of give you, and again, I understand you guys know this stuff, but again, picture says 1,000 words, and I want to show you guys a few things here in just some second. So like I said, garlic, broccoli sprouts, and Brussels sprouts. Okay, eggplant and kale. So make sure you guys are writing these down, okay? Very, very important. Red cabbage and or green cabbage, okay? Dark green leafy vegetables and or berries, all right? So strawberries, preferably blueberries, blackberries, and raspberries, all right? Green tea, all right? But again, these are packets of tea. And I have these here, sitting here, just to show you a picture of green tea. What I want you buying is not green tea in packets. I want you buying green tea in bulk form. And if you contact me or go to our website, I will show you exactly where to get organic 100% prevention of cancer fighting teas in bulk form. Okay? Don't go out and spend $5, $6, $10 on packets of tea because you're going to get very little medicinal value from them. All right. Pomegranate juice. You got to make sure that the juice is 100% pomegranate juice with none of the sugar and high fructose corn syrup in it, and or you can make it at home. All right. Beets or beet greens. Very beneficial for your liver. But don't forget and don't throw out the green leafy part of the greens that are on top of the beets, which everybody is throwing out. Put those in your salads once you've washed them and juice them. All right. Peaches or apricots. And once you get done eating the peach or the apricot, I want you to eat the peach or apricot kernel, because that kernel contains something called B17, also known as laetrile. And that is a specific chemical that is anti-cancerous, okay? And a lot of therapies that people go to different countries, for example, Mexico, or call me, or go to Europe to try to find some of these therapies. These are the chemicals that they're looking for that are usually sold in injection form or tablet form. These are also contained in certain kernels and seeds within some of our fruits that we have, right? Lemon, and then some of your peppers. Now, why did I so out of that entire list, I only laid certain vegetables and fruits down here. What I want to do is I want to point out a couple things that a lot of people just don't think about, especially when they're first diagnosed with cancer. And whether you're diagnosed with cancer or you've never been diagnosed with cancer, I want to talk about prevention, because I'd much rather you do things on a daily basis that prevent you from getting cancer, heart disease, diabetes, or any other problems. And these things here are specifically anti-breast cancer, okay? Not just breast cancer, but they help to prevent cancer because of the high amounts of antioxidants in it. So I don't mean if you eat this, you're never going to get cancer. That's not what I'm saying. But the more of these things you eat, the more of the vitamins, minerals, and antioxidants you're going to get on the inside of your body, which means the less likely you are from getting one of these diseases, okay? And the reason why I put this stuff here on this cutting board is to just show you a few examples, all right? Let's start with garlic. You've probably heard me say this time in and time out. Garlic, one of the pound for pound best foods on the planet. Increases white blood cells, natural killer cells, lowers cholesterol, lowers blood pressure, antiviral, antibacterial, and antifungal. Okay? One of the best foods that you can possibly eat. Just cut it up really finely, sprinkle it on top of your other foods that you've made. All right? The cabbage. Okay, you heard me talk about the cabbage for a second. Both of these cabbages, there was a study, it was about 15 years ago, that showed eating cruciferous vegetables, especially broccoli, Brussels sprouts, broccoli sprouts, and cabbage, specifically red cabbage. Okay, green cabbage helps, but red cabbage is packed with nutrients that help to prevent breast cancer specifically. Okay, so remember, the darker the color, the more vitamins and nutrients there. So you're going to get tons more nutrients from this red cabbage than you are this. All right? Same thing with the peppers here. Why did I put these here? Whether you're buying bell peppers or you're buying sweet or the smaller peppers, the whole key is that, remember, if it's green, whether it's a small pepper or a green bell pepper, yes, there's vitamin C in there, and yes, there's different nutrients in there. But if you buy the orange, yellow, or red bell peppers, or the smaller ones, the vitamin C and nutrient content goes up 2 and 3 times what a green one is, okay? So if you have the option of buying a darker colored fruit or vegetable, buy the darker colored, because every single time, the darker the vegetable, the more nutrients in it. And that's what I want you to remember, all right? The darker the berry, the darker the vegetable, the darker the fruit, the higher concentration of vitamins, minerals, and amino acids in there. I'm Dr. Joe Brown. I hope that was helpful. If you have any questions or you want that list of foods that help to prevent cancer, heart disease, diabetes, or any other problem, click on the information below, subscribe, click the notification list, write me down comments in the video, below this video, and or go to our website. We have tons of information on there. I'm Dr. Joe Brown. I hope that was helpful. Your health is in your hands.